My name is Janice Aldridge. Welcome to Ponderosa Pond. We're out in East Tennessee, and we're glad you're coming along for our little adventure. We hope you have as much fun as we do. Hey, everybody. I hope you all have a wonderful day. I just want to share something with you. I've been watching in our area COVID-19. I heard about it in January, but they said it was nothing, no big deal. Then the pandemic came a few months later, and the lockdown, and nothing happened. And now we have lots of people that have gotten sick, but not very many people have died, and not very many people have gotten severely sick. But what I want to talk to you about is, I do know 4 of the 7 people in our county that have died from COVID-19. They're all over 65 years old. I know 2 people under 65 that went to the hospital with COVID-19, went on the respirators with COVID-19. They were given hydroxychloroquine. 24 hours later, they're off the respirators. A couple more days, they're out of the hospital. And you said, well, see, it's a senior thing. No, that's what they keep telling us. There is a cure for this COVID-19. It's called hydroxychloroquine. Now, I talked with a friend recently who said hi. And I said, did you ask for the relative? Did you ask them to give you hydroxychloroquine for your relative? Yes, I did. They said no. They said, we're just going to put your family member on a respirator so that they're a little more comfortable till they pass. Well, that friend is working on getting said family member, which is now off the respirator, okay? Because that family member was over 65, so they weren't even trying to treat the family member. They were just keep this person comfortable. Well, beat the odds and is off the respirator, and they're trying to get some physical therapy and come home. Been in the hospital for a couple months over this whole deal. A simple little thing of hydroxychloroquine. They specifically have asked for it and were denied it. Denied it. Now that they're trying to get their senior family member who has been in a hospital bed for 2 months, trying to get them into a physical therapy place, they can't. Why? Because the family member is still testing positive for COVID-19. Even CDC says that that should not stop you from doing anything. Once you've had the test, you got 3 months where you're going to test positive. But they still cannot get any further treatment. Why? I am not a conspiracy theorist. I don't think the world is out to kill all the seniors. But I'm just saying, with this COVID-19 thing, the odds are definitely stacked against you if you're a senior. And it's not that COVID-19 is worse for you as a senior than it is for me, just under 65. No. It's that they may give me hydroxychloroquine, the cure for COVID-19. But if you're over 65, they're not going to. So all these people that I knew that had it, and we were just starting to find out about this hydroxychloroquine, and I'm like, why do these people die? Because at the same time, while these people were dying in the hospital, these other 2 people that I know were in the hospital, got the hydroxychloroquine, and they're out. So why doesn't everybody get it? And that's something to ask. That's something to consider. If you have a family member that is over 65 and gets COVID-19, you ask for that hydroxychloroquine. They go in the hospital, you ask for it. Now, I know they're not giving it to everybody who comes down positive. They're saying just suffer through with it. I know a lot of people that have had it. Headaches, nothing works on the headache. Might have a fever, congestion, all this stuff, sore throats. But if you make it through it, it's a few rough days, kind of like the flu. You'll have a few rough days. But if you don't need to go to the hospital, then you don't need to. If you do need to go to the hospital, you need to get there. And then your family needs to start asking for hydroxychloroquine. You need to go in and just find a doctor who will prescribe it. If your insurance company won't pay for it, it's cheap. Buy it yourself. You go out to eat out one time a month, you can afford this stuff. Just get it for them. Because that is the trend that we're seeing in our neck of the woods. And if it's this happening this much in our area, I would say that it's probably happening in your area too. Just saying. They say CDC.org says there is no cure for COVID-19. But I'm telling you, we know too many people, we're seeing too many results where if they get it, they're getting well. They're coming off the respirators and they're getting out of the hospitals. But if they're over 65, they're being denied the opportunity to just test it, just try it, see if it works. What's it gonna hurt? What's it gonna hurt? So I'm just saying, if you know somebody who ends up going on a respirator with COVID-19, there is a cure. There is a cure. There is a cure for it, and it gets them off of the respirator and back on the way to health very quickly. Not many people can get it though. If you're over 65, you're gonna have to fight for it. Just saying, let's get out there and let's start fighting. Let's start fighting for our seniors. Let's start fighting for our seniors. Telling everybody to wear a mask is not fighting for our seniors. Fighting for our seniors is, hey, go and advocate for them. Go and find a doctor. Call every doctor in your state until you can find somebody who will issue a prescription for it. Go out of state and get it. Whatever you have to do. And it's going to be hard. But we got to do something to help out our seniors. We got to do something to help out our seniors. It's just, you got to do something to help out the seniors. They are being denied medical treatment. Now, if you've gotten the COVID-19, CDC will at least say that, you've got to go and really dig and research to find it, but you can find out a lot about this COVID-19 and what really works and what doesn't. So, social distancing, like with anything, look, there's a lot of stuff out there that's worse than COVID-19. Social distancing ain't a bad deal. Washing your hands frequently, especially in public areas, is a really good idea. I've been practicing that for a long time. I don't care if people think that I'm like a germ fanatic or whatever. No, I'm not. But before I eat anything, I wash my hands. And I don't just rinse them off. I scrub them under the running water, scrub them. You need to do it for 20, 30 seconds. It's not that long. It's not going to kill you. It will help keep germs down. So there's a lot of things that are worse than COVID-19, and some of these things they're saying for us to do is a good idea. Wearing masks. Too many people are getting infections around on their face, and rashes and infections, and starting to develop too much moisture in their lungs, which, by the way, sets you up for pneumonia. Just saying. So that when you do finally get COVID-19, you can just be a candidate to get pneumonia and go right to the hospital. Do some more research on these masks. Start researching it. Don't just follow along with all this stuff. It's time. Look, yesterday was Patriot Day. It is time we take America back. Let's take America back. Let's take our safety back. Let's advocate for our seniors. And let's start doing our research. Don't just take my word for it. And please don't take the media's word for it. Do your own research. Do your own research. I hope y'all have a wonderful day. I hope you don't get COVID-19. It ain't fun. It really ain't. I mean, being sick never is. So I hope everybody has a healthy life and that you do well. But if you do get it, there is a cure. There is a cure. Hydroxychloroquine. Fight for it. Y'all have a wonderful day.